Hello, and welcome to Pearl Magazine. 55 million people around the world now suffer from dementia. By 2050, the World Health Organization predicts that number to soar to 139 million. There is still no cure for the illness, but scientists at the Hong Kong University of Science and Technology have come very close to one. Pearl Magazine's Ambrose Lee finds out how their recent discovery of a genome-editing technique could potentially cure familial Alzheimer's disease once and for all.
我哋做運動好冇啊？我哋夠鐘做運動，好啊！我哋揾 bench 做運動。
I'm Man, and I'm a carer for my 98-year-old grandmother who suffers from moderate dementia.
4 years ago, Man's grandmother was diagnosed with dementia. They now live together with Man's parents and a helper. She says that because of the disease, everyone in the family had to relearn how to communicate with Grandma.
As simple as communication, we noticed the elderly with dementia are quite stubborn without even realizing it. If we carers insist on certain things, it might make everyone unhappy. There were a few times when our helper wanted to bathe Grandma, but she wouldn't cooperate like she usually does, and then she started throwing tantrums.
Man said she told her helper to try distracting her and not insist when the bathing must happen, and try again in 15 minutes or so. So far, the tactic has worked.
Because of dementia, Grandma's character and habits have changed, and she could no longer control her emotions, especially with those around her. With this in mind, we have to work out how we communicate with her.
你睇呢度，幫我數下幾多錢？夠唔夠錢買晏晝食？
Her short-term memory is not very strong, but she remembers her old habits quite well. She used to buy groceries when she was young, so she knows this is cash and knows the importance of identifying and counting it. This activity helps train cognition and her muscles. It doesn't matter if the sum is wrong. I just want her to do something and to stimulate her brain.
As Man works hard to look after her grandmother, her concerns for the family loom large.
Of course, no one knows how much of this is hereditary yet. Even if it's not, I'm still worried for myself and my family. What will happen if one or more of us has dementia in the family?
In Hong Kong, 20 to 30% of seniors aged over 80 suffer from dementia. Dementia is a syndrome that leads to deterioration in cognitive function beyond the expected usual consequences of biological aging. As the population ages, it's estimated Hong Kong could have as many as 280,000 dementia patients by 2036. While there is no cure for the illness, researchers at HKUST have recently made a breakthrough discovery.
Genome-editing uses advanced technology to modify the genetic materials in living organisms. So we can delete, insert, or replace specific genomic segments of DNA. We actually use genome editing technology to ultimately correct the mutations in familial Alzheimer's disease.
Alzheimer's disease is the most common form of dementia and accounts for 60 to 70% of cases, according to the World Health Organization. In this recent study, led by Professor Nancy Ip, her team of researchers targeted specific mutations that cause familial Alzheimer's disease, which accounts for 500,000 patients in China alone.
For this group of familial Alzheimer's diseases, it's known that there are specific mutations that result in those diseases. So we use the genome editing technology to correct these mutations.
There are 4 key features to this scientific breakthrough. First and foremost, the ability to overcome an invisible wall between the body's blood circulation system and brain cells, the blood-brain barrier.
So the blood-brain barrier actually separates the periphery from the brain. If we want to target the cells in the brain, the treatment needs to have the ability to cross the blood-brain barrier in order to have access to the brain cells. So the genome editing system that we have developed has that ability. So it can target the brain cells that need to be corrected. Right.
And previously this wasn't possible.
That's right.
Another key feature is easy administration. By using genome editing technology administered by an intravenous injection, the blood-brain barrier can be crossed so that it can correct targeted brain cells across the entire brain. The third key feature is the ability to treat the entire brain, a procedure not possible in existing open brain surgery, which targets localized areas.
It is important to develop a technology for the entire brain because some brain diseases affect multiple regions in the brain, such as Alzheimer's disease. So it requires a technology that can correct the mutations in a brain-wide manner.
The fourth and final feature is the lasting effect of the treatment. In their research involving laboratory mice with one injection, the conditions characteristic of Alzheimer's disease were ameliorated and cognitive deficits could be repaired. The effects lasted for 6 months, roughly 1/3 of a mouse's lifespan.
What you see here, section of the brain, and the white dots refer to the major pathological changes in the brain of the Alzheimer's disease transgenic mouse. This is without any genome editing. This is after genome editing. And you can clearly see that the white dots are much reduced. So genome editing can effectively ameliorate the pathological changes in the brain of the Alzheimer's disease mouse model. It is promising. I would say it gives us a lot of optimism, I would say, to have it also working in the humans.
But Professor Ip says it could take another 5 to 10 years before the technology can be tested on humans. She says the same technology could be applied to cure other neurodegenerative diseases such as Parkinson's or Huntington's. Skeptics, however, have questioned the use of genome editing on humans on ethical grounds. Professor Ip says the technology would not cause changes to the genes of a patient's children.
The technology itself would not affect the offsprings because the technology simply is just correcting the mutations in the brain of that individual. So it would not have that issue at all.
Professor Amy Fu has worked with Professor Ip on neuroscience research since 1993. She is one of the researchers on this project.
I think we can say that it is a milestone, as this is the first time showing that the genome editing can reach a high efficiency in the animal brain. So this definitely provides strong experimental evidence to show that we can use the genome editing approach to develop the therapeutic strategy for the brain diseases that are caused by genetic mutations.
While the development for an Alzheimer's disease cure is underway, the lab is also devising a blood test that could be used as a definitive diagnostic tool for the disease with 96% accuracy, something that has so far not been possible.
Numerous studies have reported changes in the brain 10 to 20 years before the individuals have some clinical symptoms such as memory impairment. So these changes in the brain, we believe, can be detected using our blood tests.
Existing tests involve testing one's reflexes, coordination, eye movement, speech, and sensation. Professor Ip says the blood test shows changes in blood plasma protein levels, an indicator of the onset of Alzheimer's disease. The research team developed this system that could identify 19 plasma proteins out of the 429 plasma proteins associated with Alzheimer's disease. Once identified, the system can determine what stage of the disease the patient has.
It is simple. It requires a small volume of blood. The accuracy of our blood test is over 96%. And we can get the result within 3 days.
She says the blood test marks a major leap from existing diagnostic tools. These tools include the Montreal Cognitive Assessment, which relies on subjective evaluation, lumbar puncture, which requires surgery and is invasive, and brain imaging, such as a PET scan. Such tests can be costly, but Professor Ip and her team are hoping their test would cost no more than a few hundred Hong Kong dollars.
We believe that the blood test we have developed can be used at a population scale. And I hope that one day it will be included as part of an annual blood test for the population.
In addition to early diagnosis, the blood test could also perform other functions.
If an individual is at risk of developing Alzheimer's disease, he or she can take the blood test on a regular basis and monitor how it changes over time.
By monitoring one's progress and making lifestyle changes accordingly, regular blood tests could help to slow the progression of the disease. It could also help test the efficacy of medication for Alzheimer's disease.
Pharmaceutical companies can use our blood tests to show that after taking the drug, actually the profile of all these proteins in the blood, they change, right? The blood tests that we have developed actually has huge potential, not just in terms of diagnostics, but also in terms of developing therapeutics.
Of course, if the day comes when it can be completely treated and it doesn't take a huge toll on the patient, we are willing to give it a go.
Man says not only is this great news for the patients, but also family members who must spend a lot of time doubling as caregivers.
Once they know a family member suffers from dementia, they have to embark on caretaking immediately. This could potentially mean sacrificing one's job and income. However, if I do a test which, for example, tells me that I'm likely to suffer from dementia, then I could start working out how my financial plan, my health plan, and my career plan pan out. For an elderly person like her, we just wish for her to be happy, which would definitely help with her mental and physical health. Grandma is already 98, and no one knows what the future holds. I really treasure the time I can spend with my family.
After the break, a look at how dementia patients are being cared for at home and at elderly care homes in Hong Kong. Stay with us. Welcome back. For a seventh consecutive year, Hong Kong has boasted the longest life expectancy of any country or region in the world. But there is a downside. More older people also means more people at risk of dementia. Experts predict Hong Kong could have 280,000 dementia patients within 15 years. Ambrose Lee takes a look at how dementia patients are being cared for in Hong Kong now.
各位老友記早晨，早晨，早晨，知唔知今日係幾年幾月幾號？其實我哋今朝早咧主要做咗3樣嘢啦。
So this morning we did a few things with them. First of all, we'd greet our residents.
同啲老人家去先打個招呼。咁打完招呼
Afterwards, we'd do something called reality orientation,
同佢哋講下今日嘅日期啊、時間啊
telling them what date it is today. Then we start some exercise.
開始做一啲嘅
Mr. Fong is the deputy superintendent at this first purpose-built elderly care home for dementia patients. He starts every morning with an exercise routine for groups of residents.
We hope that through exercising, their muscles can be strengthened. On the other hand, we hope to help make their joints more flexible, which also helps prevent their muscles from shrinking. The body also makes dopamine when you exercise, which makes them happy.
This is just one of the routine activities for dementia patients at this 3-story facility.
Each floor is themed. For example, the first floor is a simulated community space that resembles Hong Kong in the 50s and 60s. That's why we've designed this retro restaurant space to recreate how residents used to have dim sum with friends.
Mr. Fong says that because residents are not allowed to leave the premises by themselves, staff will buy takeaway dim sum and have them served in bamboo steamers for the residents. They also hold some workshops in this space.
We explore different old objects with this group and reminisce about the bygone days with them. It's also to encourage them to socialize with each other.
He says that musical elements help stimulate the brains, which in turn can potentially help revive some long-term memory.
If we were to sing something, combining it with music, it's much easier for old folks to remember certain things.
Mark Chan is a resident occupational therapist. He provides different therapy or training sessions here. For those with mild dementia, he runs a horticulture class where he pots plants with residents. Not only does this help with their eye-hand coordination, it also gives them a longer-term goal, ultimately a sense of satisfaction from nurturing and growing a plant. But he does something entirely different for residents with other needs.
This sensory room is for the moderate stage or severe stage dementia. They can explore this environment safely to get some sort of sensation. For example, the elderly will have different sensation stimulation, like we will use the musical instruments to provide some auditory cues for her to feel it. And we may use some aromatherapy oil to do some massage so that it will feel some tactile sensations.
Mark believes these sessions are helpful because those with severe dementia often have very confused sensations, which can lead to behavioral problems. This can help them be more in tune with their surroundings and help them relax, which is extremely important for dementia patients.
Maintaining a good psychological well-being for them is also very important because maintaining a good attitude is essential in living well in the elderly home, especially they are living with the other residents and their family member cannot see them in the COVID situations.
His job also extended to helping with the design of the care home.
This is a monitoring system. It can detect the elderly coming out of the bag. Usually, it will use at night. And when the elderly wake up at night, then, for example, the leg cross this monitoring sensor, it will connect to the apps and then give the alarm to our nurse so that they will come here and find out what they need for help.
Mr. and Mrs. Ho have been married for 38 years. About 7 years ago, Mrs. Ho was diagnosed with mild dementia.
I do my best to take care of her. Her mother is in her 80s and won't be able to help much. I had a daytime job, but they struggled to manage themselves, so I had to look for an overnight job. Once I got an overnight job, everything was okay. I had to work to her needs because she is my top priority.
Mrs. Ho's mother usually takes the overnight shift after she's been put to bed. It has not been easy for Mr. Ho. He constantly worries that his wife will get lost.
One time, I didn't know there was a back door in the McDonald's in Sham Shui Po near the toilets. I had no idea. I thought, what was taking her so long? Oh no, luckily she knew her way back. She took the long way back. I was very lucky.
Another time, he almost lost her in the Shatin MTR station. She had wandered into a supermarket 15 minutes away.
She wears a trackable watch, and I made a phone call to the watch. She can no longer tell where she is anymore. And this watch is very loud. Some supermarket staff was close to her and told me where they were.
This watch, which doubles as a phone with a video call function, helped Mr. Ho locate his wife.
It's better safe than sorry, even when I hold her hand almost at all times. These are precautionary measures.
He also participates in a community scheme that aims to prevent dementia patients from getting lost. It makes use of a specially made card.
So we interviewed over 500 caregivers and we discovered that over 30% have had their patients' family members go missing. While most were found within an hour, some of them were injured, were out overnight, and were terrified.
With help from the Hong Kong University of Science and Technology, the NGO has developed a system that uses Bluetooth signals from these devices. The devices can work for up to a year on just one battery charge.
These iBeacon devices give out Bluetooth signals. If a patient is missing, the caregivers can report it on the app. Then everyone with the app installed will be notified with a photograph. Then they can help look for the missing person.
There is another key reason why the NGO uses Bluetooth instead of the more common GPS-backed tracking technology.
Some caregivers use GPS to locate their patients, but they might forget to charge. So then the devices can't actually help locate patients. Sometimes they can still give out clues on the first day they're lost, but not on the following days.
8 months after the scheme was launched, the app already had 15,000 downloads.
The government should give them some resources. I hope more people can use this so that it will be more effective. If new software could be developed, that would be great, because it should be updated annually.
That's our show for this week. Next week on Pearl Magazine, read all about it. During the COVID-19 pandemic, more readers are reading more books, online and off. See you next time. Bye for now.